You can't talk about the first-hand story without starting with Cerner. Cerner was started in 1979 by 3 brilliant entrepreneurs. They also knew from day one that at some point they would create a collective way for Cerner to be able to give back to the community and the world.
In 1995, 16 years later, Jeanne Lillig-Patterson, Neal Patterson, and Cliff Illig, the first-hand founders, created something that would change Cerner's corporate culture forever. As entrepreneurs, they built a unique model of corporate philanthropy that was different than any other. It included some of the same attributes that are clearly recognized in Cerner: entrepreneurial, innovative, strategic.
Our founder's vision was to take all Cerner's knowledge and resources in health and care, our associates, technology, clients, and business partners, and make a direct impact on the well-being of a child. The impact included providing life-changing and sometimes life-saving grants to children who fell through the gaps of healthcare. First Hand started with funding individual grants, and in 1995, you all helped change the life of our first child. As we enter our 24th year, First Hand has provided over $28 million in grants to children in 93 countries.
In addition to individual grants, we started giving children facing difficult times a bag filled with basic necessities. What began as filling the need of children in the Kansas City foster care system has grown into helping children in underserved populations and through disaster relief. After the first decade, our founders challenged us to leverage Cerner's technology to help even more children and families. There was an opportunity to make an even bigger impact by creating proactive population health programs. Programs that would be built and launched right here in Kansas City and replicated worldwide.
First Hand's visionary, Jeanne Patterson, was passionate about identifying more children, especially here in the Kansas City community, that had unresolved, or even in some cases, unknown health issues. That was the birth of our first population health management program, which was designed to offer free wellness screenings to elementary students. On average, 43% of the students will have a health issue that requires follow-up care, validating the need for the program. Our commitment is to close the loop for every child and ensure that they get access to care. First Hand develops innovative models such as this one that have been replicated in other communities.
We needed to focus on the high schools as well. As we all know, this is an age of tough decisions, and our judgment may not actually be as good as we would hope. First Hand offers a healthy lifestyle curriculum that teaches students how decisions they make today will impact their future. This 10-day curriculum was developed from the CDC's list of most preventable diseases. It's designed to give students the tools they need to take charge of their health. To round out our K-12 footprint and complete a full suite of population health solutions, this year we launched a program focused on mental health for middle school students. Mental health is important, and this is absolutely a gap we needed to fill.
In order to extend past our K-12 footprint, we built a wellness center in Belton, Missouri, where the average age of the population is 64 years old, 45% don't speak English, and 70% have one or more chronic conditions.
Just like Cerner, First Hand is global and has a strategic presence. Associate volunteers and community partners extend the First Hand mission by replicating its innovative models worldwide, focusing on where there is a gap to fill. In the past year, First Hand gave back $13.2 million in value around the world. That is $1 million globally, $2.3 million across the U.S., and $9.9 million right here in Kansas City.
So what started as helping one child in 1995 has evolved into changing the lives of hundreds of thousands of children and families around the globe. So now, First Hand is not only improving the health of children and families who are already facing health problems, but we're also creating healthier generations for students in school, work, and life.
We have done this by remaining focused on our mission, while remembering that we are entrepreneurs and always looking to innovate.
You are a huge part of this story, and you're in every part of the story. So the next chapter is ours to write. Let's make it the best ever.
Hey guys, what is up? My name is Nathan, and if you all don't know me, I was one of the first grant recipients for First Hand, and I just want to give a quick thank you to everyone who gives, because without you all, I wouldn't be the young man I am today, and anything that First Hand does wouldn't be possible without you all, so I just want to say thank you for that.
First Hand helped me when I was 15 and paralyzed in a car accident. They gave me a grant which paid for physical therapy to help me get to where I am today. Thank you, First Hand.
Thank you to all the people that donate to the First Hand Foundation. which has allowed me to be here at Craig, one of the top facilities in the country.
I would like to thank the First Hand Foundation for donating $5,000 to my eSight fund. Thank you so much, and I'm so grateful that you were able to donate.
Thank you, patients.
Thank you to everybody that helped me get my eSight glasses.
Thanks First Hand for all you do for our kids.
We appreciate you.
Thank you, First Hand Foundation.
Thank you, First Hand Foundation.
Thank you, First Hand. Thank you, First Hand.
Thank you.
Thank you.
To date, you've changed the lives of over 400,000 children and families around the world, and this is just the beginning.